Good morning, everyone. I'm Supriyo Chatterjea from the Data Science Department at Philips Research. Welcome to Valencia. Welcome to the BigMedilytics event. It's a great honor to have so many of you here this morning. Today's presentation is about how we can actually transform healthcare and through the use of big data. Now, before I get started, I'd like to just have a raise of hands. I'd just like to know how many of you actually checked in today for your flights. I know many of you have flown through. How many of you actually checked in using a mobile phone app, for example? Yeah, okay, yeah, so quite a few did that. How many of you used Google Maps or some other kind of navigation to find your way here? Because it can be a bit challenging. There's a lot of people there. Now, when it comes to healthcare, how many of you have actually used an app to get in touch with your healthcare provider at some point? A lot lesser number of hands, but it's good. We have some hands. But you see that there's quite a big disparity between how we go about in our day-to-day lives and how digitization has actually impacted our lives. And that's what this workshop is about over the next 2 days. It's about trying to understand what is it that we can do to make sure that the digitization that's happening and the big data that's being generated in the healthcare sector, how do we actually take advantage of that to make this more pervasive throughout society? Because that's what's lacking right now. And we believe that there's a lot of advantages that we can get by doing that. Now, there's several profound trends that are currently being faced in the healthcare sector. We all know that there's tremendous pressure in terms of cost. It accounts for around 10% of the EU's GDP, and that's simply not sustainable. To make matters worse, things don't get better actually over time in the sense that we are all aging, and since we are living longer, there's also higher incidence of chronic illnesses, and of course has an impact on the healthcare costs. But it's not all doom and gloom. That's the reason why we are here today, because you also see that increasingly consumers or people in general are really trying to see what can we do to make sure that we can live healthily. And on top of that, probably the most important trend with respect to this particular conference is the fact that we are now at a stage where a huge amount of data in healthcare is actually being digitized. The question is, how do we make use of all the data that's being digitized to change healthcare itself? Now, if you want to see what the impact is on healthcare because of these trends, you first need to understand how to measure the quality of healthcare. And you see that you can measure it by looking at the quality of healthcare that you receive, how accessible healthcare is, and of course the cost to the patient. Now, of course, in an idealistic world, you would want to optimize all these three issues. But what happens very often is that if you are building more hospitals, for example, yes, access improves. You might have more care providers there, so the quality of healthcare would also improve. But of course, the cost goes up as well. And that's something that, so it's very difficult to optimize the three things together. And that's where the BigMedilytics project comes about. It's a Horizon 2020 project under the ICT 15 call. Started back in 2018, so we are halfway through the project at the moment. It runs for a period of 3 years, 35 partners across 12 countries, and we receive 15 million euros in funding from the European Commission. Now, the aim of the project is to use state-of-the-art big data technologies to improve productivity of the healthcare sector by reducing cost to the patient, improving quality, through better patient outcomes, and delivering better access simultaneously. And that's the key word, because the expectation is that using big data, because it's such, it's a technology with huge amount of potential, we could probably try to optimize all three aspects at the same time. Now, in order to maximize impact, we cover a large part of all the disease groups in Europe, which cause 78% of the deaths. And we also take a holistic view of healthcare in general. So instead of looking at the traditional way people usually look at healthcare, which is within the boundaries of the hospital. We actually look at the entire health continuum, which goes from healthy living to prevention to diagnosis, treatment, and home care. You'll notice over the next 2 days that we'll have many sessions which are broken up into 3 themes. That's because the whole BigMedilytics project is subdivided into 3 themes, namely population health, oncology, and industrialization of healthcare. Industrialization of healthcare refers to the optimization of workflows within the boundaries of the hospital. But the other themes are going across the healthcare continuum. So what are some of the challenges that are faced in this project? Now, if you look at the key stakeholders in the healthcare sector, you have the healthcare providers, so that those are the health systems, the general practitioners, hospitals. You have the health technology companies. You have the payers, or the insurance companies. You have the pharmaceutical sector. If you look at each of these sectors individually, they actually generate a lot of data themselves, and they use the data that they generate themselves to optimize their own product and service offerings. What we are trying to do in this project, in some of the pilots at least, is to see what can we do if we integrate the different data streams that we have from these various verticals, of course, in a privacy and in a privacy-preserving manner. And once you have integrated this, you have new insights which you wouldn't have been able to get if you actually looked at each of those verticals individually. And once you have those insights, you can drive those insights back to the various verticals, and they can then not only improve their current product and service offerings, but probably also offer new services which wouldn't have been possible if they weren't actually looking at things in an integrated manner. But of course, technology is not the only thing that you need to look at. You also, in order to scale the concepts across Europe, especially when it comes to healthcare, you need to understand the fragmented scenario across Europe, right? So what does it mean in terms of business model innovation? What does it mean in terms of ethics, in terms of the legal aspects? And only if we look at these things holistically can we actually scale these concepts across Europe, because that's the ultimate aim of the project. We have 35 partners across 12 countries, from healthcare providers to payers, health tech, pharma, SMEs, research institutes, and of course universities. The whole project is divided into 3 themes, as I said, and every theme has its own subset of pilots. There are a total of 5 pilots. Under population health, we look at things like comorbidities, kidney disease, diabetes, COPD and asthma, and heart failure. Under oncology, we look at prostate cancer, lung cancer, and breast cancer. And under industrializing healthcare services, we look at hyperacute workflows in the emergency department, such as stroke and sepsis, asset management, and finally radiology workflows. And we're going to have presentations today covering many of these pilots. We won't be able to cover everything, of course, but we do have posters downstairs covering the entire project. So yeah, you will get a glimpse into some of the pilots, and if you have information, if you'd like to have further information about the other pilots, please don't hesitate to go down to the booths and find out more. I'd like to highlight some of the key aspects of the project and actually the purpose of today's event. So when we started writing up the proposal several years back, this was under the ICT 15 call, as I said, and there were certain things that they had specified in the call, because it wasn't a call which was focusing on healthcare per se. It was a general call and open to all sectors. And they said that we had to demonstrate an improvement of productivity of at least 20% in the chosen target, in the chosen sector. That was actually something that we thought a lot about. How do you actually define 20%, right? Because you come up with a particular figure. 20% seems huge in the healthcare sector. And how do we achieve that? So we actually have people, you will see that in all the different pilots, they're talking about KPIs, because that was really a focus of the various pilots. We need to make a change, and if you want to make a change, you need to know what are the KPIs and how do we measure the KPIs. We'll also cover that in one of our talks. It was also about maximize the impact by involving more than 100 organizations, and that's the reason why many of you are here today. We refer to our external partners as external exploitation partners. The objective here is for us to tell you about our experiences in the BigMedilytics project, but it's also for us to receive feedback from you to see what do you actually think about the pilots that we are working on, because we are halfway through our project. We could actually use that feedback to make further improvements over the remaining course of the project. It's also about increasing the use of big data technologies. I'll quickly go through the agenda for the next 2 days. So we have plenary sessions in the morning. One thing I would like to highlight are the parallel breakout sessions at starting from 3 o'clock. They're for all the three themes, so population health, oncology, and healthcare industrialization. And also there's a parallel breakout on data analytics. The objective of the workshop is for us to gather feedback from you, as I said, so we will have very interactive sessions where we will be presenting our pilots, and we would like to actually actively gather your feedback there. And finally, we have a poster session later on in the evening, followed by dinner. Tomorrow we have, it's not only about BigMedilytics, we wanted this to be a real knowledge sharing event, so we actually invited other EU projects also working in similar domains. So they will be having presentations here, and we'll also have parallel sessions in the afternoon. There's a security workshop, security, privacy, and legal workshop, and there's an AI in healthcare workshop being organized by the BDVA. And we also have a networking session for coming up with future collaborations later on. I'd like to mention one thing before I finish. During all the plenaries, in terms of questions, yes, you're more than welcome to ask questions, of course, but you can also go online to Slido. Where did that just, yeah, there it is. On the bottom right-hand corner, you see if you go to Slido, please enter event code 226, and you can post your questions there, and we'll try to see, based on the amount of time available, we'll try to squeeze those questions in as well. So with that, I come to the end of my presentation, and I'll hand it over to Javier to continue. Enjoy the next 2 days. Thank you.